and just flagging it for him. I don't know if he has to kind of give me permission to screen record or how
Yes,
that works.
you should have permission.
You can't record on an iPad. The iPad does not allow you to record.
Oh, okay. Christina, we'll
I think
on our
photographer
YouTube.
Jason Weitzman is also on here. Just making sure, if you see a local 10 account, that you give us permission to record.
I gave everybody permission.
Okay, awesome. Thank you so much. Appreciate it.
Perfect. All right. Good morning, everybody. Mayor Gimenez has already joined us, so we'll go ahead and get started. Mr. Mayor, out to you.
Good morning, everybody. I hope everybody's having a good day. Today, I'm announcing the launch of the county's voluntary community empowerment program. This voluntary program, which will be up and running at noon today on miamidade.gov, will help expand our contact tracing efforts. The focus is to test, check in, and recover. Residents are asked to get tested and then check in by completing a brief survey to participate in contact tracing and assist the county's recovery from COVID-19. The survey can be accessed on a computer or a mobile device through a hyperlink. Survey results will be displayed on a dashboard that will be accessible through the Community Empowerment Program website. This program does not involve a downloadable app. Internal Services Deputy Director Jacques Ventolia is available here to go through the program details and a mock-up of the empowerment dashboard. I want to thank Jacques and the IT and communications teams for getting this going. During our Q&A, Jacques will demonstrate how the empowerment program will work. We're also preparing to launch the Combat COVID app, which can be downloaded for Apple and Android devices and complement the website program. Combat COVID app is a Bluetooth-based app that uses a digital key exchange when two mobile devices with the app are in close proximity for a short period of time. When one user reports a positive diagnosis through their app, a notification is sent to all devices that have exchanged the key with the positive user's device within the last 14 days. So people can steer clear of certain hotspots and also get a heads up on whether they should get tested. This app does not use GPS information, so that should reduce any concerns about privacy and also the program eating up your battery consumption. We expect to finalize a contract with the vendor in the coming days, and the app will be available to download in a few weeks. I've met with officials in Broward and Palm Beach counties to explore a regional approach for this contact tracing app, since so many of our three county residents are crisscrossing across our three counties. Palm Beach is already in the process of launching the same app, and Broward County is exploring using the same tech. This is a great opportunity for the Tri-County area to send one unified message to Southeast Florida residents. Yesterday, the Board of County Commissioners took a very important step to help us tamp down this current spike by unanimously approving a civil citation program that went into effect immediately. It gives our police department and our code enforcement officers the authority to issue civil citations of $100 for individuals and $500 for businesses that do not follow our new normal rules. That means that you must wear a mask inside public places and outdoors, you must social distance, or you may get fined. You're a business, and you must follow all the rules, including capacity limits and requiring your patrons to wear face masks, or you will get a civil citation of $500. The civil citation ordinance now gives our county a two-pronged approach and enables code enforcement to act swiftly. Miami-Dade Police Department continues to have the authority to go the criminal route at businesses that continue to flout the rules, and that means facing a second-degree misdemeanor with up to 180 days in jail for owners. Also, individuals who are unable to pay the $100 fine will have to do community service. We're in the midst of a pandemic, and everyone needs to take personal responsibility, follow all the rules. This is really about life and death. Also, commissioners yesterday approved a $30 million hospitality grant program to help small restaurants that have had to close their interior spaces because of the current spike in COVID cases and increased hospitalizations. Another $5 million will be considered by commissioners on July 21st. That money will be used to help unemployed or furloughed hospitality workers. We're partnering with Florida International University, which already has experience in a similar program that the hospitality industry had for its workers. We're trying to help our small businesses and their workers as much as possible until we can start opening up again. I also have good news on our effort to stop community spread, particularly at multi-generational households. In partnership with the state, Miami-Dade County is adding another 400 hotel rooms to insulate individuals who test positive for COVID-19 so that we can protect at-risk family members from getting infected. This program is focused on homes where there's not enough room to isolate. I want to personally thank Governor Ron DeSantis and Emergency Management Director Jared Moskowitz for their partnership and swift action on expanding this program. They will be paying for it. It's a critical step to help stop the spread of the virus in multi-generational homes where parents and grandparents are at higher risk of getting severely ill from the virus and winding up in the hospital. I know that we've had a program like this for some time. The county's existing program pays for hotel rooms for individuals who have been released from the hospital but still need to isolate and are recommended by the Florida Department of Health to go to a hotel. This new 400-room expansion will also help families with a member who has tested positive but does not necessarily have any symptoms, so that person can still spread the virus to family members. The recent spike in COVID-19 infections among 18 to 34-year-olds has put multi-generational families at particular risk. And as we all know, it's very common in our community to have 3 generations living in the same home. I want to stress once again, until you see me blue in the face, everyone must take personal responsibility. Wear masks inside public places and outdoors. Stay 6 feet apart, social distance. And if you live in a big family, take measures to protect your loved ones if you are out and about. Trying to protect those most at risk from the virus, and we also have to help our hospital workers, the doctors, the nurses, all the personnel who have been working 24/7 since March to save lives. Wearing a mask will save lives. It's not a theory, it's proven science. Not wearing a mask can be a death sentence for you or those around you. Please take it seriously. Also joining me today are Deputy Mayor Jennifer Moon, Deputy Mayor Maurice Kemp, Deputy Mayor Ed Marquez, Police Director Freddie Ramirez, Deputy RER Director Lourdes Gomez, who can help answer questions as well. Now I'll take any questions you may have in English first, then Spanish. Patty, what do you have?
Thank you, Mayor. I'm going to go ahead and ask folks who want to ask a question to raise their hands on the Zoom so that I can see who I can call on for the next question. But I'm going to start off with those I know that have questions for sure, and that will be starting off with CBS 4's Peter Dench. Good morning, Peter. Go ahead and unmute. Peter, where'd you go? We just talked right before you came on the air, Mayor, so I don't know where he went off to. Okay. Let's get into Blitz at NBC6.
Thank you very much. You can all hear me, correct?
Yes.
Thanks. Mr. Mayor, can you just kind of elaborate for us or maybe create a scenario as to how somebody would receive a $100 fine for not wearing their mask?
Simply by having one of our code enforcement officers watch you not wear a mask. Somebody can tap you on the shoulder and say, here, there's a citation for you not wearing a mask. And so that process begins today. The emergency ordinance was passed yesterday. And so this simplifies the process. You don't need a police officer to be involved in the issuance of the citation. Previously, because it was a second-degree misdemeanor, a police officer had to be involved, and also you were subject to an arrest record, etc. So this makes it a lot easier for us to enforce the rules.
And just quickly, with respect to people exercising, riding bicycles on a street, the masks are required there as well?
Not when you're exercising, when you're doing some strenuous activity, but you must be at least 10 feet apart. So, when you're running, jogging, you need to maintain your distance on a strenuous activity. There are exceptions to wearing the mask. I think kids under 2 years old, or you have to, maybe you have some kind of medical condition that precludes you from doing that. Outside of that, or you're doing exercise, but if you're doing exercise, you need to be 10 feet apart from everybody else.
Thanks, Mayor.
You're welcome.
Thank you, Mayor. Peter's having a little trouble, I guess, with his connection and with unmuting, so he's asked me to ask you the question on his behalf. He's saying, what is it going to take to get this pandemic under control?
Simply us. It's going to take us to change our behavior. Young people to stop partying, stop going to social events. Even older folks like me, stop having events with our families for a while, or you do take the appropriate measures while you're having that event. Maintain social distancing, continue to wear a mask, even with your family members, because now we see that the spread is now inside the home. And so, older folks need to protect themselves. They're the ones that are most vulnerable. But the younger people need to act more responsibly and stop the socializing. That really is the root cause of why we're having this spike. And so we're going to take particular interest in places of assembly. People are having parties. I'm hearing that there's a lot of activity in party boats. And so if you're an operator of a party boat and you have more than the number of people you're supposed to have on any kind of boat, then you may find yourself in serious trouble. And so we're going to be focusing in on that. We're going to be focusing in on the curfew, especially in some of the entertainment areas, to make sure that the curfews is enforced, so that we stop as much as possible. And it pains me to do this, much as possible, social interaction among people that aren't in the same household, because that's how this virus is spreading right now.
Thank you, Mayor. Next up, we have Greg Allen from National Public Radio. Greg.
Hi, Mayor. I want to ask what you hear from hospitals, from Jackson Health particularly. I guess we heard yesterday that they've exceeded ICU capacity. What's that mean? What do you understand is going on?
We have not exceeded ICU capacity. I know our dashboard says we have more people in ICU than there are supposedly number of ICU beds, but hospitals have the ability to add hundreds of ICU beds simply by not having elective surgery. That means that you can convert all the recovery rooms into basically ICU rooms. And so we have, if you look at our dashboard, we have 450 ICU beds normally, but you have the ability to add another 500. And so hospitals are adjusting, on a daily basis. What we've seen over the last 4 days, at least prior to yesterday's data, we don't have today's data, was a 2% rise in hospitalizations over the last 4 days before that, from Monday, Tuesday, Wednesday, and Thursday, which was a significantly, less increase than we've seen before. So let's see what happens today with our data. Maybe we're plateauing, but in any event, we still have capacity here in Miami-Dade County. Although, we're making preparations for, increasing or having this surge continue. The hospitals, the CEOs of the hospitals, we're in communications. We're talking to the governor about putting more personnel down here, more nurses, doctors, et cetera, because we're finding that some of the healthcare professionals are actually getting sick. And so they're losing people that way. We need to replace them. We need to augment them so that we can open up more spaces.
Do you know how Jackson Health has reacted here? Have they where they gotten the beds from? Do you know?
Internally, it's all internal. They just convert other rooms into these rooms, and so I know today I talked to the CEO Carlos Migoya. He said he actually had a reduction in the number of patients in ICU. He actually had a reduction in the total census, so that was good news, at least from Jackson. But this is, we look at it as a system-wide, all of the beds, all of the ICU beds, all of the ventilators in all of Miami-Dade County. And so we even talked to the folks who are in Broward and Palm Beach, because it's a region also. So, they're okay. Yes, they're getting stressed, but he feels that he has sufficient capacity and also the ability to expand to keep pace with what's going on.
And if
Thank
I guess,
you, Mayor.
Yeah,
Go ahead, Greg. I'm sorry.
Just one more. Do you anticipate the Miami Beach site being used at this point or not?
No, it's not, and it's not manned. So it's there up, but it's not running. And so we'd rather have the personnel go into the hospitals and increase the capacity in existing hospitals. If once we get to the, basically that's it, 100%, they're using all of their physical spaces, then it's time to start looking at that facility at the Miami Beach Convention Center. But right now, no, nobody's going to the Miami Beach Convention Center right now.
Thank you, Mayor. Glenna Milberg from Local 10.
Good morning, Mayor. Hi, Patty.
Good morning.
Hi.
Yesterday, Mayor, during the commission meeting, you had mentioned that right now there is no mass lockdown contemplated. And on the same day, Mayor Suarez said he'd be meeting this morning with 25 other mayors to discuss the possibility of what it would take, what metrics, what point, etc. Are you concerned with another sort of patchwork? Because the county is obviously your call to make, but are you concerned with another looming patchwork of different rules and total lockdowns and the sorts?
Yes, I am concerned about that. But what I understand that the mayor of Miami said he was going to meet with 25 business leaders. And what I read that he was going to meet with 25 business leaders to find out from them if there were a lockdown, what kind of assistance they would require from the city of Miami. I have no problem with that. Today at 3:00, I'm meeting with the League of Cities, and all of the mayors are invited to attend that particular virtual meeting, and we'll discuss this and other topics. But this a patchwork doesn't help anybody. A patchwork doesn't confuses the people of Miami-Dade County. And if you heard me yesterday, I think it's time that we put something on the ballot to the people of Miami-Dade, not for my benefit because I won't be here, but in the November ballot question that once a state of emergency is issued for the county, really needs to, we need to have one voice. And that voice needs to be, Miami-Dade County, the mayor of Miami-Dade County. It won't be me because I'm turned out. So it's not self-serving, but the next mayor needs to have that tool. This patchwork is not helping anybody. And it's very, very difficult to control, 34 other mayors, 34 other politicians, and it doesn't help anybody. So I would hope that somebody from the commission puts it up, and that the people of Miami-Dade County get to decide that as a charter question.
Thank you.
Welcome.
Thank you, Mayor. And to everybody, make sure to raise your hands on Zoom if you want to ask a question. Up next is Andy Slater.
Hey, Mayor, did that catch you by surprise yesterday, what Mayor Suarez said in the city? Because that was just 1 or 2 days right after you had your roundtable with the governors and other mayors saying you guys are going to have one message and be on the same page. You're in the commission meeting yesterday saying it's not time to panic, and Mayor Suarez is in the city saying, hey, I'm going to meet with the business leaders because we may be shutting down.
Yeah, it caught me by surprise. But I think, when I read deeper into the message, it was he's meeting with business leaders to say, if we get to this, then how can we help you? That's not quite the same thing saying that we're going to shut down. Also remember, people in Miami-Dade have to understand, city of Miami, it's our biggest city, but it's only 15% of this county, 15% of the population, and it's a sliver of what Miami-Dade County really is. But it does cause confusion. And it did cause, I guess, some kind of panic that people had started thinking that, hey, we're going to shut down and it's imminent and Miami's going to shut down. I don't think Miami, at least I didn't take it from his statement that he's thinking of shutting down today or tomorrow. But again, it goes back to the point that we need to have one unified voice. I did not know about the meeting. And so, that's okay. Today we'll talk about it. Hopefully he'll be on this call at 3:00 and we'll talk about it and we'll discuss it with the other mayors as to what they're thinking. And also I'll have a discussion today with my medical advisors about what next steps are. Like I said, I'm going to look for the data today to see what it says about the hospitalization, et cetera. The last 4 days, we've had a 2% rise over the last 4 days. That's not a very significant rise. So, let's see what happens today and see if we can continue. Again, it's how we act. We're the ones. It's all in our hands. Okay, it's all in our hands, and we need to keep our masks on, keep our distance on, and then even inside the house now, we have to be a little bit more careful.
Thank you, Mayor. Next up, we have Rosa Flores from CNN.
Hi, Mayor. Thank you so much for the opportunity. We received a statement from your office explaining that the ICU beds are at capacity, but of course, the county has more beds that they can continue to convert. So in essence, and I'm looking at your dashboard, so in essence, the ICU bed capacity is at 107%, but the county continues to convert more beds to ICUs, correct?
Yes. That's a rolling number. What the normal number of ICU beds is the top number on that dashboard. And then you'll see right below it, like number of 500. Those are beds that can be, those are beds that could be converted to ICU in a pretty fast way. And so, yes, it's 107% of normal capacity, but we haven't reached, absolute capacity where there's another 500 beds available.
Got
but
it.
Again, that all depends on staffing, right? And that's why we need additional personnel, and the governor is helping us with additional medical personnel to be able to staff those beds. Some you can do internally, I give you an example. If you stop elective surgery, those medical personnel that would take care of in recovery room are now able to take care of people in an ICU situation. So some of it is internal, and some of it, you need additional help.
I see. Now, so when I was, as I look at the dashboard, I know that it's designed to help you take a look at the data very quickly. I see the red flag for the downward trajectory, not looking good. The red flag for the positivity rate, not looking good. The ICU capacity at 107%, not looking good. As you look at these metrics, what is going to trigger for you to take the next step, i.e. impose more restrictions in Miami-Dade County?
Well, we look at my bottom line is hospitalizations, and look at the hospitalizations, and that level has continued to go up and up and up. We may have to take additional measures for that. About a week ago, I sat with my medical advisors, and we had already taken some steps. We had taken the step of a curfew. We'd taken the step of closing some of these occupancies where people gather, and then, recently we took the step of closing the interior spaces of restaurants. And then they advised me to, hey, why don't we, let's see if how these measures will grab a hold. And it doesn't really make sense to do a whole bunch of stuff one right after another, because you never know what is it that worked. So we're right now in a pause. We've seen that the increase in hospitalization has kind of, plateaued, at least for now, for the last 4 days. And so let's see what happens in the future. If something else happens and all of a sudden we see another spike coming, there may be, other measures that we have to take. But at this point today, all right, we're still waiting to see what are these measures. Those measures that we put in place now increase enforcement, which we're going to, really focus in on with this new civil citation program. If those measures take place, and then you all, and the message that we all have to give, which is wear your mask indoors and out, keep your distance, social distancing, wash your hands. And now the additional message of even inside your house, you need to take additional measures, because there may be somebody in your house, especially if you live in a house with 4 or 5 people going out and about, that may be bringing it back into your home, and you need to be extra careful. And you need to be extra careful with your friends and your family when you get together. Try not to get together as much as possible.
And when you say that you're looking at other potential measures, what are the next measures that you're contemplating, Mayor?
Well, we go backwards. What did we open up last? What we opened up last is the first thing we opened up going back the other way. Closed going back the other way. And so, we started out when we were more locked down. We were essential businesses. Obviously, restaurants were open, but only for takeout and pickup. There was no exterior dining. We also had non-essential businesses that were closed. We may be starting to look at something like that. So, if you want to see kind of the roadmap of how we're going to be closing, if we ever get there, which I don't want to get there, it's basically backwards of how we opened.
And then finally, I know that Mayor Suarez mentioned yesterday that for him, that trigger point is a few days or perhaps a week away. For you, what's your timeline that you think based on the data that you have now?
It's all in the data. The data that I have right now, we keep a steady, if our hospitalization rate stays at the same rate, the number of people in the hospital, then we can sustain this for a while, right? And so, no, I'm not ready to say it's a couple of days or a week or whatever. I need to see what's happening, and then talk to my medical advisors to say, what other steps can we take? What other steps do we have to take? Remember also, this is a balancing act. Starting to shut down again, it could cause irreparable damage, irreparable harm to people and their livelihoods on a permanent basis, where they won't come back to a job. There won't be a job for them to have. And so you got to consider that, okay, when you make these decisions. It's not something that I'd say, well, okay, let's just do that. Hey, it's okay, I have a job, no big deal. Well, hey, the decisions that we take, have to be made in a measured way, because the decisions that we make could cause irreparable damage, not on a health perspective, but on an economic basis, for a long, long time. And so, again, I take this very seriously, and I will speak to my medical advisors, on what the next steps should be if we have to take them.
Thank you, Mayor. I appreciate your time.
It's my pleasure.
Okay, Mayor, Christina Vasquez is actually on and she's listening, but she's driving. So she's sent me a couple of questions from her. Isolation hotel beds, what is the current total? And when will protocol for how a family requests or secures one be finalized? Do they call 311?
I'll be happy to hand that off to one of our deputy mayors, Maurice Kemp, who's going to be in charge of that program. That started, we got those beds yesterday from the governor. Thank you, Governor. And then we've had a program in place that has certain criteria. The new program will have different criteria. So Deputy Mayor Kemp, can you answer the question?
Yes, sir, Mr. Mayor. We currently, with the beds that the governor provided, we currently have 400 beds. We already had 100. So we have, 500 beds, 400 plus the 100 we already had. The criteria is being changed to expand the program, and we expect to have that criteria announced today. The whole idea, as the mayor indicated, is to provide a place for citizens to go when they need to isolate so that they don't infect their families.
And Deputy Mayor Kemp, who decides?
My intent, Patty, is to, and I told the deputy mayor yesterday, is that I want all 400 rooms occupied. You get 400 people that could be infecting other people, other folks and their families off, and get them inside a hotel. So we haven't had that many referrals in the first 100. We need to expand this program and quickly to get those that could be infectious away from their families so that we don't infect maybe 2, 3, or 4 people inside that household.
And how is that determination made, Deputy Mayor Kemp? They're referred from the hospital as they are being discharged. How does that work?
So the current program, the hospitals refer the folks to the Department of Health. They screen them, and then we provide transportation and get them into the hotels. The expanded program will also have provisions for folks who are not at the hospitals to get into the program. And we haven't ironed out all the details, but we will have them ironed out by close of visit today, and it'll be publicized.
Thank you so much. And one more question from her. She's asking about the $100 civil citation, Mayor. This will be a deterrent for folks willfully choosing to continue violating the new normal rules. Is that correct?
That's correct. That's exactly correct. But it's also a way for us to, kind of bring it home easier than the criminal option that we had. We only had the criminal option before. Now you have the criminal or the civil option. So it also allows our fire inspectors and building inspectors, the different inspectors that are now also working on the COVID-19, to be able to issue those citations. Before, it had to be a police officer who had to issue those citations.
Thank you, Mayor. Does anyone else have a question in English?
Yes, I do, if I can pop up. Hi, Mayor. This is Stephanie Liebergen from Newsy. Question regarding availability of treatment drugs for people that are in the hospitals. We've talked a little bit about the ICU beds kind of filling up in the county. Have our hospitals had any problem getting enough treatment drugs, the remdesivir, painkillers, sedatives, et cetera? If we've had any other problems, like how has the governor stepped in, or has the governor been involved in all in replenishing our supply here?
Yeah, everybody knows about remdesivir, and remdesivir is an issue not only here in Miami-Dade County, but apparently around the world. There's a shortage of it. We were down to about 48 hours at Jackson 2 days ago, and then the governor stepped in and gave another 48 hours of the drug. So the governor is taking a very, very active role in bringing down remdesivir into the state because we are one of the hot spots. And so hopefully we can get a lot of this remdesivir diverted to the state of Florida so that we can give our patients. But remdesivir is an issue, and the governor is very active in getting us more.
And then a question on the new citations that are available, as well as the criminal actions that police could be taking before. What does that criminal action look like thus far? Have Miami-Dade police been handing out the citations that they previously could to individuals and businesses?
No, there's been businesses that have been shut down by Miami-Dade police, and we have that number. We've done hundreds of thousands of inspections. The vast majority have been compliant. We've had thousands of warnings that were issued to businesses. Some businesses have been closed. And from my understanding, one individual was actually handed a notice to appear, which means technically they were arrested. Somebody operating a some kind of a bar thing that had been worn before. And so this new program allows us to go ahead and just issue the citation, the fine, much easier than the old system where you'd get a criminal record. You'd have a criminal record if we issued. I think that's why the police were kind of hesitant to do that, trying to give more warnings, trying to be more educational, etc. Now it's not the time to be, warning or educating people. People understand what they have to do. Please wear your mask indoors and out. Business owners, you know what you have to do. And if you don't, and if we catch you, you're going to get fined. Okay.
How many people are out enforcing the new citation beyond the Miami-Dade Police Department? How many people do you have out and about, kind of on the lookout for folks that are not following the rules?
I got two. I have Director Ramirez and also Lourdes Gimenez, who's the Assistant Director of RER. Lourdes, do you have that number with for RER inspectors and also fire inspectors who are out working on this program right now?
Yes, sir. I believe it's over 60 in total. I mean, it changes on a daily basis because of staffing issues, but it's a good 60 at least.
Okay. What about in police, Director Ramirez?
Yes, good morning. We have approximately 100 officers on a COVID detail during the day and 100 on the afternoon. And just on the note for the civil citations, we started last night. As of this morning, we've issued 35 civil citations already and closed 3 businesses since the order was put in last night. And we'll be out in force again through the weekend.
Very good. Okay. It's already started working. Okay.
Veronica from WLRN.
Good morning, Mayor. I just have a quick question about then the community service component. How are you all going to determine if someone can or can't pay it? And then what kind of community service would you all hope someone would do?
This is a program that's been established for a long time, civil citations. And so they're going to go through the civil citation process. I don't have the details of that. Maybe, Director Ramirez has the details of that, of the civil citation process. They've been involved in this process for a long time. There are a lot what used to be crimes here in Miami-Dade where somebody would get a record, have to go to jail, that were now being devoted to a civil citation program so they don't get a record. And we also don't overload our jail system. And it's been very successful. So, Freddie, how does that process work?
That is correct. There is numerous lower offense crimes like possession of marijuana under 20 grams, trespass, where normally would be an arrest situation. We issue the citation. This program was started by Commissioner Sally Heyman a few years ago. And what we did is we just added this component now to the other instances where we could use and deploy the civil citation.
No, but Freddie, if somebody gets a civil citation, they cannot pay and
they go into
service hours, what happens?
Yes, if they cannot pay, then our legal bureau coordinates a diversion program where they do community services to help pay for that fine. That keeps them out of the.
And how do they determine if they can't pay, or how do you accept, let's say, their reason? Or
my legal bureau coordinates that. They give their reasons like any other situation that they cannot pay, and then they offer those measures so it's resolved. Similar to anything else with other fines and other situations through municipal services.
Got it. Thank you very much.
You're welcome.
Thank you. Mayor Doug Hanks from the Miami Herald has texted me a question. Apparently he's not on the Zoom call. He is asking, do you think the charter should be amended to restrict emergency orders by city mayors in Miami-Dade? If not, what are you suggesting to create the one voice?
No, I think I think I answered that in the beginning. I think a charter amendment needs to be put to the voters of the people of Miami-Dade. Look, when there's an emergency situation in this region, we need to speak with one voice. We need to have one set of rules. It doesn't mean that there can't be nuances in a particular area. I'll give you Miami Beach an example. Their entertainment district. It may take, different rules than the rest of the county, but it needs to come out out of one area. One voice needs to be, the voice for when it's an emergency situation in this county. You can imagine the havoc that can be created and it can be created. Let's say we have a hurricane coming here. And then all of a sudden there's a whole bunch of different people saying different things about how we're going to deal with that hurricane. That's not something which is beneficial. The mayor of Miami-Dade County is elected by all of the people of Miami-Dade County. It's the only one outside of maybe the state attorney and the clerk of the courts that really is elected entirely by the people, all the people of Miami-Dade County, all the cities, all the unincorporated area. And the mayor of Miami-Dade County is a strong mayor position, the administrator of Miami-Dade County. Unlike most other, political entities here and, political members of the political establishment, the commissioners and mayors, the mayor of Miami-Dade County is a full-time job. And that's what the mayor of Miami-Dade County does. He's the mayor, all right? And so it needs one voice. It does not mean that you don't listen to other mayors and take their issues in consideration, but it causes mass confusion here when you have different messaging coming from the same area. So I do think that we ought to put it to the people of Miami-Dade that once an emergency order is issued by the mayor of Miami-Dade County, that, that's on that particular issue, that's the individual who should be in charge of the emergency that is being confronted by the people of Miami-Dade County.
Thank you, Mayor. And before we go to questions,
And one other thing, one final thing. This is not self-serving because again, this is not going to. This is for the next mayor. I'm termed out. If this goes before the people in November, it won't take effect until I am out. And so this is not a self-serving kind of issue, not self-serving kind of proposition I'm putting forward. I won't take advantage of that. I can't. But the next mayor should not be facing the same situation that I've been facing here for the last 3 months.
Thank you again, Mayor. And before we go to questions in Spanish, I know that Jack Ventolila has some information. I know that we've talked a lot about contact tracing. There's been a lot of interest from the media and everyone on this call, and I know that Jack has some fresh information to share. So Jack, do you want to go ahead and give us that new information?
Yes, good morning. At the direction of the mayor, we have launched the Community Empowerment Program. It is accessible. It will be live at 12 o'clock at miamidade.gov/community-empowerment. That website will allow our citizens to access testing as well as the survey for this new program. This is a new voluntary program and complements contact tracing. The state's contact tracing efforts focuses on individuals who are COVID positive and researches the other individuals they may have been in contact with and contacts them to notify them that they should get testing. This program actually is going to be focusing in on locations of possible viral transmission. So we're asking those who have tested positive with COVID to take this survey and does not ask for any personal information, any residential information. It does ask for their movements within the last 14 days for us to be able to hopefully track cases as well as patterns of possible viral transmission areas within public transportation, as well as businesses and beaches, and hopefully be able to allow the county to strategically deploy resources to areas to try to tamper down flare-ups. Also will provide the community the ability to see this live real-time information of what's being reported over the last 14 days. So it is a tool in the combat against this pandemic that will allow for informative real-time information based on a voluntary population taking part. So we do have the availability of the website. If someone cannot access it via the web, they can call in. The number is 305-614-1819. Again, it's 305-614-1819. And we'll have our call takers assist them in filling out the survey so that that information does get captured. And of course, everything is in English, Spanish, and Haitian Creole, so that way everyone can participate and be part of the solution in combating this pandemic.
Thank you, Jack, and I'm sure we'll be sharing all that information on the mayor's social media accounts as well as on the Miami-Dade County government social media accounts so people can get that phone number and all the website information as well. Thank you so much for sharing that. Now we'll move on to questions in Spanish. First up, we have from Univision, Channel 23, Erika Carrillo. Buenos días.
Buenos días. Hola, ¿cómo están? No sé por qué sale el nombre de mi marido, sorry. Alcalde, buenos días. Le tengo dos preguntas. La primera es, usted hablaba hace un momento que lo tomó por sorpresa la rueda de prensa de ayer del alcalde Suárez, porque crea un mensaje que puede confundir a todo el condado. Y esa era una de mis preguntas. El criterio, ayer el alcalde Suárez no supo tampoco responder el tema de qué criterio podrían ustedes tener en cuenta para un posible cierre, y escuchándolo a usted me quedo igual con la misma duda. Es decir, mucha gente quiere saber qué podría llevar a que se ordene el cierre, o que sobrepase algún porcentaje de camas, o que sobrepase algún porcentaje específico el número de contagios nuevos. ¿De qué depende que ustedes den esa orden de hacer un cierre nuevamente o de regresar a la fase 1?
El problema, Erika, es que esto no es una ciencia determinada. Esto es, tienes que tomar medidas y la tienes que tomar cuando piensas y también tiene información que eso es lo que debe de hacer. Pero no hay un número. Cuando llegamos a 27.657% de las personas que tienen una prueba, entonces tenemos que hacer esto y lo otro. Lo que tenemos que es vigilar lo que está sucediendo con los pacientes que están entrando en el hospital, y eso se ve y se indica que esto no se está normalizando, o por lo menos estabilizando. Entonces puede ser que tenemos que tomar otras medidas. ¿Cuáles son esas medidas? Todo cambia de día a día con este virus, así que es muy difícil de decirte a ti con una claridad, certainty, que cuando llegamos a este punto tenemos que hacer eso, porque esto no es una ciencia. Este libro todavía se está escribiendo. Sí, hay ciertas medidas que estamos tomando, ciertas cosas que estamos vigilando. Estamos vigilando cuántas personas están entrando en el hospital, cuál es la capacidad del sistema. Si ese nivel está siguiendo una curva, se está acelerando o se está bajando, decelerando. Si se está estabilizando o todavía sigue en una manera que causa cautions, ¿no? Que causa preocupación. Así que todavía no hay nadie, yo creo, que te pueda decir cuando llegamos aquí tenemos que hacer esto, cuando llegamos allá tenemos que hacer eso. El gobierno federal ha dicho que para abrir necesita que tengas el nivel de los exámenes positivos, tiene que estar a menos de 10% por 14 días antes que pueda empezar a abrir. Ahora estamos mucho más alto que el 10%. Ahora, no te dicen cuando tienes que empezar a cerrar otra vez. Eso es algo diferente. Así que todo esto es guiado por tenemos reuniones, nuestros médicos nos avisan y tomar todo esto lo tenemos que tomar en consideración antes de tomar una decisión para cerrar.
Alcalde, usted hablaba de la confusión que crean todas estas ruedas de prensa, que un alcalde de Miami de una rueda de prensa ayer. Hay mucha gente que no entiende la diferencia entre ciudad de Miami y condado Miami-Dade. ¿Cuál es su mensaje también de pronto para los residentes que ayer prendieron las noticias y vieron a un alcalde diciendo posiblemente vamos a tener que volver a un cierre para áreas como Kendall? Para quien se levantó ayer en Kendall y vio esa noticia y quedó confundido, ¿por qué le sorprendió lo que pasó ayer en Ciudad de Miami?
Bueno, yo no sé si cuando lo que leí era diferente de lo que la impresión. Lo que leí es que él iba a tener el alcalde Suárez iba a tener una reunión con 25 individuales que son parte de la comunidad, de los negocios de la ciudad de Miami, que son dueños de negocios de la ciudad de Miami, para determinar que si se cerraba en la ciudad de Miami, qué podía hacer la ciudad para ayudarlos a ellos. Eso es algo diferente. Así que está tomando una precaución, está recibiendo información a en qué manera se puede ayudar todos estos negocios si se cierra la ciudad de Miami. Yo no tengo un problema con eso. Ahora, el mensaje que dio era que ya estaba haciendo eso, es que bueno, lo están pensando y puede ser que pasado mañana se va a cerrar la ciudad de Miami. Yo no sé si lo aclaró o no, pero yo he dicho que yo no estoy listo a este momento a empezar a cerrar el condado de Miami-Dade. ¿Cuál es la diferencia entre la ciudad de Miami y el condado de Miami-Dade? Bueno, la ciudad de Miami es 15% de lo que es el condado de Miami-Dade. Son 400,000 personas en un lugar de como 36 millas cuadradas, adentro de un condado de casi 3 millones de personas y 2,000 millas cuadradas. Así que eso es la diferencia. También la ciudad de Miami tiene un gobierno diferente del gobierno del condado de Miami-Dade. Y el alcalde puede tomar decisiones o el administrador puede tomar decisiones adentro de la ciudad de Miami. Es el administrador que firma las órdenes para cerrar la ciudad, etcétera, antes que lo haga el alcalde del condado, pero ellos no pueden tomar pasos menos estrictos de las medidas y las decisiones que toma el alcalde del condado de Miami-Dade. El alcalde del condado de Miami-Dade representa todo el condado de Miami-Dade, todos los residentes que vivan en un municipio o no. El alcalde de la ciudad de Miami nada más que representa a las personas que viven adentro de la ciudad de Miami.
Alcalde, el tema del medicamento Redemsivir. Ayer el senador federal Marco Rubio en Twitter se mostró preocupado diciendo que aparentemente no había una muy buena comunicación entre el gobierno federal y el estado de la Florida, porque unas horas antes el gobernador había dicho en una rueda de prensa que había suficiente Redemsivir en los hospitales y que el medicamento no hacía falta. Sin embargo, el senador Rubio en los twitters que puso ayer dijo que por el contrario, que el próximo cargamento que va a recibir la Florida está pautado para el día 27 de julio y que él tiene información de hospitales como el Jackson que el medicamento podría acabarse de un momento para otro. Hace 2 días el director también, Carlos Migoya, insinuó, dijo que en 48 horas habían acabado el medicamento, que creo que era para 1 o 2 semanas. ¿Qué sabes sobre el tema? ¿Cómo está Jackson con respecto al medicamento? Y le preocupa que en algún punto lleguemos y que sea muy tarde para pedirlo al gobierno federal y que no llegue o que se demore el cargamento?
La conversación que yo tuve con el gobernador indicó que él sabía que había un problema con el Remdesivir y había pedido al gobierno federal que por favor mandaba más el Remdesivir aquí al estado de la Florida. Él sabe que eso es un problema, pero acuérdate que esto es un problema no solamente aquí en el estado de la Florida, pero todo el mundo, porque no se puede crear suficiente Remdesivir, en suficientes números para toda la demanda que hay, no solamente aquí en los Estados Unidos, pero en el mundo. Así que yo sé que él aceleró, el gobernador aceleró el shipment de que se supone que iba a llegar hoy, llegó el lunes, pero hasta con todo eso, ya en como 2 días se usaron lo que normalmente se estaba usando en 2 semanas aquí. Él mandó más ayer yo creo que llegó más Remdesivir aquí, pero todavía estamos cortos en este condado y vamos a ver si él puede acelerar más. Como somos un lugar donde la crisis está subiendo o está caliente, puede ser que pueda traer más Remdesivir, pero el gobernador está arriba de este problema y está pidiendo al gobierno federal más ayuda. También yo creo que han cambiado la manera en que se envía el Remdesivir. En vez de ser usando el gobierno federal, están ahora contratando directamente con la compañía para tener más Remdesivir aquí en el estado de la Florida. Pero es un problema y él lo sabe que es un problema.
Gracias, alcalde. Ahora pasamos con Telemundo 51, Alejandro Isturiz.
Gracias, Pati. Alcalde, muy buenos días. La consulta que le quiero hacer es con respecto a lo que pueda suceder a partir de la semana que viene, si es que este nivel de contagios sigue y se espera un pico, según se anunció en los últimos días, para la semana que viene. ¿Qué va a pasar si se terminan la disponibilidad de camas en los hospitales? ¿Tiene el condado pensado abrir hospitales móviles para recibir a toda esa gente contagiada, así como sucedió, por ejemplo, en Nueva York?
Bueno, ya tenemos un hospital que ya está establecido en el centro de convenciones, tienen 500 camas ahí más adicionales y sabemos que se puede construir bastante rápido otras 500 camas más en el centro, lo que es el Youth Fair, la feria en Miami, se puede construir otros 500. Así que lo que es necesario es las personas que van, las personas médicas, los personal médicos, etcétera, enfermeros, que pueden abrir y pueden rendir servicios ahí. Así que el espacio está construido. Lo que se necesita son las personas que van a operar el hospital. Son 500 camas. No estamos ahí todavía. Hablando con el director de Jackson, Carlos Migoya, él cree que aunque él piensa que vamos a tener el pico en la primera semana de agosto, que lo que está indicando él es que sí, él tiene la capacidad la capacidad para absorber ese pico sin superar su capacidad. Así que todavía no estamos ahí. Vamos a ver cuáles son los datos de hoy. Como he dicho, los últimos 4 días, hasta el jueves, había subido un 2% el número de pacientes con COVID-19 en los hospitales. Ellos ahora están haciendo todo lo posible para despedir más y más pacientes de los hospitales, para crear más y más capacidad dentro de esos hospitales. Así que todavía no estamos ahí, pero sabemos que tenemos que prepararnos para lo peor, siempre rezando por lo mejor, pero preparándonos siempre para lo peor.
Alcalde, en caso, ya fue anunciado en las últimas horas con respecto a la obligatoriedad de utilizar las mascarillas en espacios públicos. Y sabemos, aunque los médicos dicen que esta es una de las maneras sí o sí para tratar de evitar un contagio, entre otras importantes, hay gente que se niega a usarlas y que se resiste. Lo hemos visto públicamente en diferentes videos y situaciones que se dan. Pero en este caso, la policía de Miami-Dade saldrá a buscar a la calle gente que no la use y de esa manera va a tener su multa, o va al azar cuando recorren, cuando patrullan las calles, al azar. Si ven a alguien, lo van a multar y lo van a llamar al orden.
La policía del condado de Miami-Dade ahora tiene dos herramientas, 2 tools, una criminal y una civil. La policía y ahora también nuestros inspectores del departamento de fuego, de los inspectores del departamento de lo que es el Building Department, de construcción, también tiene la herramienta que ahora si te ven en la calle sin la máscara puesta, te pueden dar una multa. Si entra en un negocio y ese negocio no está cumpliendo con las regulaciones, le puede dar una multa de $500. Si sigue ese negocio en el mismo paso, se pueden convertir en un problema legal, que es mucho más, tiene un peso más grande. Así que sí, por eso pedimos esta ordenanza ayer en una manera de emergencia, para empezar a impulsar en una manera mucho más efectiva las regulaciones aquí en el condado de Miami-Dade, porque esto es parte de la salud de nosotros. Si hay personas que se van a negar a ponérsela, bueno, entonces tiene el riesgo que le van a dar una multa, y si siguen, puede ser que los pasos van a ser más serios en el futuro.
Gracias, alcalde.
Gracias a usted.
Gracias, Paola Serna.
Alcalde, buenos días. Quisiera que me hablara sobre las excepciones a la regla de las multas, quienes pudieran estar exentos de las multas, y también sobre el tema de los niños con COVID. Hay reportes que indican el contagio acelerado en los niños, que 1 de cada 3 está saliendo positivo. ¿Tiene algún conocimiento? Esas serían las 2 preguntas.
No, de verdad, no entendí la primera pregunta. ¿Cuál es la primera pregunta? Por favor?
Las excepciones, las personas que están, por ejemplo, haciendo ejercicios, a quienes no les aplica la regulación. O sea, si yo voy caminando, tengo que utilizarlo. Si yo voy haciendo ejercicio, lo hago. ¿A quienes no les aplica? Y lo de los niños.
A los niños, yo creo que la edad de 2 y menos no tienen que tener la máscara. Las personas que están haciendo ejercicio, es cuando están haciendo ejercicio, pero tienen que mantener una distancia de 10 pies de otras personas si estás haciendo ejercicio afuera. Si no estás haciendo ejercicio afuera, si no estás corriendo, una bicicleta, etcétera, entonces tú tienes que ponerte la máscara, y si no tienes la máscara, puede ser que alguien te puede tocar y decir, mira, esto está en violación, por favor póngate la máscara, y también aquí está el ticket de $50 o de $100 que tienes que pagar.
¿No va a haber un warning, alcalde? Es inmediatamente que ponen...
Ya paramos el warning, ya ese tiempo ya paró. ¿Okay? Eso es, el oficial tiene, en inglés se llama discretion, puede ser que te da un warning o puede ser que no te da un warning. Lo que yo estoy indicando, le estoy diciendo a mis policías y inspectores es que ya todo el mundo sabe lo que tenía que hacer. Ya todo el mundo sabe lo que tiene que hacer. Así que ya paró el tiempo de educación, ahora es el tiempo de enforzar. Así que si te dan la multa sin warning, bueno, el warning ya se supone que por 2 meses usted sepa lo que tiene que hacer. Y si no está cumpliendo ahora, bueno, perdón, pero eso no es culpa mía.
Gracias, alcalde. Y antes de terminar, que ya son casi las 11 de la mañana, una pregunta más para los medios en español que quieren que conteste la misma pregunta que se contestó en inglés. ¿Cómo estarán trabajando el tema de las multas? ¿Cuántos oficiales van a estar en las calles? Ese tipo de cosas.
Bueno, el director puede contestar en español y también la vicedirectora Lourdes Gómez puede también contestar. ¿Cuántas personas de RER? Lourdes, also, how many fire people are going to be out too? So combine that.
En total tenemos más o menos 60 personas que están involucradas, aparte de la policía.
Freddy, ¿cuántos policías van a estar haciendo esto en la calle?
Siempre tenemos 100 por el día y 100 por la noche. Son 7 squads que están trabajando por todas las áreas del condado. Y también ayudamos en las ciudades también.
Perfecto, muchísimas gracias. And with that, I think we are done for today. Mayor, any last words you want to say before we head into the weekend? Any reminders for our residents?
Yeah, I do. I want to make again, until I'm blue in the face, please wear your face mask inside and out. Please keep your social distance. Please wash your hands. Please keep your hand away from your face. But one additional thing is that in your family, in your own family, I know that we have a lot of our family that lives in our community, and we love to get together with our family because we love them dearly. But maybe for a couple of weeks, how about not doing that too much? How about just basically staying to yourself? Stay away from your friends for a while, okay? Because right now we have a high number of people that have COVID-19, and the number one way of contracting COVID-19 is interaction between people. You take off your mask, you let down your guard. That's your friend, that's your family member. Give them a hug. You talk to them really close for a while. It's the number one way of transmission. So please, can we just, for a couple of weeks, let's see if we can, keep our distance a little bit. And if we do that, we can drive this down. We can give our medical people, our medical personnel, our doctors, and our nurses a break. They're exhausted, and they need a break. They're doing all that they can to save our lives. Let's do something for them too.
Thank you, Mayor. Everyone have a great weekend.
All right.